Today's online course is part two of a four-part series on how to use CMS Hospital Compare. It's a tool for you to compare different providers like hospitals, inpatient rehab, home health, hospice. It's to help you identify what is right for you and best for you or your loved ones. So, in part two, we're going to talk about inpatient rehab facilities. As always, I am going to share my screen so that I can actually show you. So just like last week, we're going to go to hospital compare. Let me put on my readers. And it was the same thing. It's this Medicare.gov that we used last time. So this time we're going to go into it and we're going to pick inpatient rehab facilities. So I'm going to put in my zip and hit search. So the inpatient rehab facilities come up and it's the same thing. You can filter. This one you can filter, is it owned by the government, a physician, because sometimes that matters. You just don't know how much that matters. Is it for profit, nonprofit? But you do it, you can go in here and you can compare it with other places. So you can pick three. We're not going to do that today, but you do have the option that if you're deciding between three facilities, you can compare them. And it's going to say the same information as we're looking at. It's just going to be showing three facilities. So when you go in here, the first is going to be conditions treated. You have to realize that sometimes people want to go to where it's Spain. They want to go to Spain, but they realize that that procedure is not, that condition is not treated, so therefore you could not go there. So always know before you start calling these inpatient, do they treat the condition in which you've had, like a stroke or a hip replacement, etc. And then just like I did hospitals, what's really important to me is quality. And just like hospitals, you can go into each of these and look up complications that they have with like pressure ulcers. You can look up infections. How do they handle medication reconciliation? They do a phenomenal job. What are the results of their care? What is the chance that when they get out of there, they're going to be able to take care of themselves or move around? Well, this place shows it's less than average. And it'll tell you exactly what that means. And like I said, this is just a great tool and it's a great discussion guide to have with these facilities. You can tell them, hey, I got on a hospital compare and I noticed that your results of care were below national average. Can you make me feel better about it? Effective care. So again, it is a great tool for you to go in, successful returning home. They do great to get your loved one prepared to going home from like after a stroke or a total hip replacement. So these are just, like I said, great tools. You need to know about them. Knowledge is power, to keep you safe in any healthcare system. So please make sure you subscribe, like, share, comment below. And as always, thank you and have a great day.